It can have more physical and sexual intimacy, but that's not a requirement. That is a thing that in partnerships is a thing that people want to experience.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronsky, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Today, we're diving into the world of surrogate partner therapy with our guest, Travis Sigley. Travis is a passionate human who cares deeply about education, care, accountability, mental, physical, emotional health, and community. They have been working in the intimacy and sexuality field for 15 years. Their first business was Cuddle Therapy, started in San Francisco as the first known professional cuddling service. Through many years and iterations since, their newest venture is in Surrogate Partner Therapy, where they are currently in the final stages of certification via mentorship. We delve into the essence of surrogate partner therapy, uncover what it entails, who can benefit, and how to approach this nuanced subject within relationships. Travis will also share invaluable insights on self-care in the realm of sexuality and navigating alternatives when access to a surrogate partner therapist isn't available. So join us as we navigate this conversation, learning from Travis's wealth of experience and dedication to fostering healthier, more fulfilling connections in the world of intimacy and sexuality. Hi, Travis. Welcome to the show.
Hi, thank you for having me. I really appreciate it.
Of course. So let's dive right in. Talk to us. Tell us what surrogate partner therapy is.
Sure. Surrogate partner therapy has been around for a few decades, but very quietly so. There's a bit of a kind of like growing culture of it now. Basically, the surrogate partners work with therapists or clinicians and their clients as a surrogate, like a stand-in partner for their clients to do some of the hands-on practice or kind of like relational practice that one might have in a partnership, but that's inappropriate for a therapist to have with their client. It involves touch, it involves connection, it involves intimacy building, and yeah, kind of giving people who are in sex therapy or relational therapy or having a lot of challenges somewhere to go practice these skills, where a lot of people they are struggling with some things that could be sorted out in relationship, but the things that they're struggling with kind of prevent them from being in a relationship. So it's this kind of cyclical thing, and there's just like no outlet to be able to like enter the world and try being close and community with people and partners. So that's kind of the basis of kind of what it is.
So how does surrogate partner therapy work? What should people expect?
Yeah, it can be a very broad range of things, honestly. It's basically the therapist and the client kind of create some goals for what it is that they're looking to achieve, and the surrogate partner comes in and has we have our sessions based on the needs of attaining those goals. So whether it be learning how to feel comfortable being vulnerable or learning how to like feel comfortable sharing touch. And surrogate partners can have a whole range of specialties and things they want to work with. And, we have a lot of training around gender, sexuality, mental health. There's a swath of what we are prepared to experience generally. And then with each individual, they kind of get a catered experience. But a lot of it is just very like presence based, touch based. Like there's a lot of like dropping into one's body and feeling safe in one's body and feeling safe to be vulnerable and intimate with another person, and to kind of get some of those experiences. It can have more physical and sexual intimacy, but that's not a requirement. That is a thing that in partnerships is a thing that people want to experience. And again, if it's in service to their goals, then it's something that can happen. And not all surrogate partners do anything. Some of them just don't kiss or have any sexual contact with their clients. And That's something kind of going in, you navigate and sort out. So it really is a kind of a practice relationship. So thinking about how you like spend time laying around on the couch and cuddling and talking about life and things, or like going out on a date and being social, or normally it's something contained into the session space and really focused on their present needs. Usually, there's a lot of need for some of this personal development piece. Um, and in all of this, also, I'm currently a surrogate partner in training. Like I'm not, excuse me. Um, yeah, currently I'm a surrogate partner in training. So I just want to name that also and say that there's a lot that I'm speaking to based on the people who have taught me, and my own experiences in this field in other departments. Um, but I just want to preface that also. So these are the things that I'm aware of, and finding my own specialty, what my niche will be. That's still a discovery.
Can you delineate for us the difference between surrogate partner therapy and sex work?
Sure. Generally, the biggest distinction and what makes this what it is, and also makes it completely and fully legal, even if there's sexual contact, is that it's in this triadic model. So you're in a therapeutic setting with your client that also involves um, another person that is there who is assisting in the growth process. That is really the thing that makes it. You're working with a licensed clinician or therapist, and you're um, supporting them in moving through their therapeutic process. Um, and that is not to say that sex work is not therapeutic on its own. And you could call surrogate partner therapy in the umbrella of sex work, but there's a lot of legal sex work, and this could be one of them. Um, so it's really the thing that I wouldn't separate them and compare them. It'd be more like, what is surrogate partner therapy? And it's in that triadic model. That's the very distinct difference. Yeah.
Thank you. So, who could benefit from surrogate partner therapy?
Good question. There, I would say any number of people with any number of challenges. Like originally, a lot of it was used for like sexual dysfunction and challenge in male-bodied people, but it has definitely grown far from that in the many years. And anyone who really has challenged either like feeling connection or maintaining relationships when they want to maintain relationships, or feeling safe in intimate spaces, or those who, there's a lot of like sexual, relational, social trauma. And really it's about, ideally you are already seeing a therapist for a little while and you have some sort of rapport and relationship. And it's something that they could bring to their therapist as an idea, like, hey, I've heard of this. Or if they already know, then, they can engage with that, the therapist themselves, or the client can bring it to the therapist, like, hey, I'd like to talk about this. And so there's certainly like ways to access more communication about it. Um, if you feel like I could use some extra support with somebody who is just like loving and caring and non-judgmental and just won't criticize my needs or my sexuality or my lack of needs, whatever it is. That I think, which is a lot of us. There are moments in my life like, wow, this could have been really nice in my earlier years of kind of like self-discovery and moving through a lot of my own challenges. Yeah.
So, where does someone look for a surrogate partner therapist?
I would say the Surrogate Partner Collective is the place that I did my training. I believe it's the only US based training that there is. And so just going to their website, I'm not sure exactly what it is like
I'll
word
put
for
it
word,
in
but
the show notes. Yeah, I'll make sure to link
perfect.
the resource.
Perfect. Yeah, the Surrogate Partner Collective is the place where they're very receptive, very responsive, and very happy to share information. And I believe they also have a resource list of different surrogate partners. Um, so that would be my first go. Or at the end of this, you'll have my contact information, and feel free to reach out to me as well.
Yeah, thank you, Travis.
Mhm.
And on that note, what if there isn't access to a surrogate partner in someone's area, how might one approach intimacy, sexuality challenges, etc., as part of their own self-care?
Yeah, I would say there's a number of things. The therapy in and of itself is really useful, even outside of, the extension of having a surrogate partner involved. Um, and that is a little more accessible because many insurances can cover therapy. That is not the case with surrogate partner therapy currently. Um, and again, like there are not a whole bunch of us, so it can be just hard to find us in general. And in general, just one's relationship with um, like shame and like kind of a negative self-talk. Like that's a lot of what people are challenged by, of like, oh, I'm doing something wrong, or I'm not good enough for this, or I'm unlovable. There's all these, kind of very classic, strangely, ways in which we view ourselves and our sexuality and our intimate relationships. Um, and really just there's nothing wrong with you or where you're at. And you could be going through some PTSD spirals from sexual trauma. I've been there myself. And just knowing that that's right where you're at right now and trying to take any more pressure off of yourself, knowing there's enough there already. Um, and just hopefully just being as comfortable as you can be in the depths of those discomforts and pains, and seeking outside resourcing, whether it is therapist or friends or your community, just someone to talk to, and just being able to be really gracious and gentle with yourself. That's really so much of what I'm offering my clients. Like if they're coming and it's like really not having a good time, again, I work outside of surrogate partner world as well. I'm used to seeing clients in this space, and a lot of it is like you're fine. There's absolutely nothing wrong here. Like you're challenged right now, and I will definitely acknowledge that and work with that, and in no way don't diminish your feelings or hide from them, but um, just try and take the shame out of the fact that you're experiencing them. It's a pretty powerful experience if one's capable of getting there. It's a long journey. Still on it myself. Yeah, just layers and layers of it.
Mhm. Mhm. What a positive, uplifting message, really, to hear. We all need to hear this message of being gentle with ourselves,
Mm-hmm.
compassionate towards ourselves. We are human after all, and are part of this human experience collectively, individually, and yeah, the message of love, loving ourselves and loving each other. So thank you. Thank you for sharing. Yeah. If someone is interested in surrogate partner therapy, but they're partnered and they're partnered, let's say they're partnered, how might that person broach the topic or communicate this idea or their desire to work with a surrogate partner therapist?
Good question. Traditionally, surrogate partner therapy was only for single people. I think that is a little bit outdated. There's a lot of support that can be had in relationships. There's a lot of non-monogamy culture in many different places. There's a lot of like, okay, there's an understanding of a therapeutic relationship outside of this, and we still have this monogamous relationship, but can get support in other ways. And again, there can be boundaries. It doesn't have to be any sexual touch. There doesn't have to be any intimacy on that front, but just helping your partner come out of their shell a little bit and like express their emotions and the fears that they have and be more vulnerable. Like those are all things that can be supportive. Um, so I think just coming to one's partner around the fact that you're interested in this and you want to talk about it, and you can talk to their therapist or a surrogate partner themselves to get personal guidance. But I think a lot of it is just understanding, like, I want you, partner of mine in this relationship, to have your needs met and understood also through this. And I feel like I want more support and help for this relationship, to show up and be a better partner for you and to be a better, just like more, more connected or more like sure of myself or more confident in like your love for me. Like there's whatever kind of the things that are up and the challenges in the relationship, knowing that seeing the surrogate partner is in service to that relationship, in service to that person being in a relationship, um, and knowing they just want extra support. So that's the thing to kind of bring into it. And
Mhm.
again, like I think having more of an individualized conversation with a therapist or a surrogate partner would be really, really helpful. Um, but initially kind of framing your ideas around it as well. Like this is for us. This is for how I can be better here and how I can do my own growth and do my own work. So you don't have to all the time, because relationships are really mutually growth inspiring, but sometimes you need a little break and work on that with other people in your life and other resources.
Yeah. Do you generally suggest that the individual who is interested in surrogate partner therapy confide or let their partner know that they are going to participate in that therapy? Or is it okay to not disclose the therapeutic process that you're about to embark on to your partner? I guess, how do you navigate that? That sounds like a very challenging
Mm-hmm.
situation to perhaps navigate, because I know some sex therapists have a no secrets policy and things like that. So how, yeah, can you talk to us about that?
Yeah, I mean, we're getting into some pretty interesting layers of ethics around all of this, and my personal philosophy around this is very much a uh, just transparency, being able to be transparent around what's going on in the process. And especially if you're going to be seeing a surrogate partner in a way that involves more sexual health risk, absolutely you need to inform your partner about your work there. And in general, I think being able to be open and honest with one's partner about your process of learning and growing in a relationship is pretty pivotal. They're very much directly involved in it, and allow them to support you through it. And if they can't support you through it, then that's something to get through together on your own. Like if your partner can't support you in trying to do better, that in and of itself is something to look at. Um, and that's kind of the beauty of transparency and vulnerability in a relationship. You get a real honest read of what each other's capacities are and availabilities are in relationship with one another. And
Mhm.
if some of your baseline needs for growth and healing are not acceptable to your partner, that's a conversation that should be had, and something to more deeply look at. And like, well, if I can't get it outside, is it okay if we do it here? Like, I need some more support, and can you provide that? For example.
Yeah, definitely sounds like a healthy way of approaching one's own needs, but also maintaining integrity of the relationship and one's values around your own individual values, but also perhaps your relational values as well. So, Travis, what has inspired you to do this work?
Great question. Thanks for asking. There's many things. I have my own history with sexual trauma. I lost my virginity in its own like traumatic experience, and there's been layers and layers of how that kind of like restoration journey of my own has gone, and the support I've received with people in my life for so many years, and that's a lot of why I got into this field to begin with. Um, and and ultimately, I really love um, caring for people and helping provide their needs for intimacy and closeness and touch and connection, so that things don't get so wild and like uncontrollable. And that's often how a lot of sexual assault scenarios happen. Like people are just lonely and isolated and like need some sort of expression, and they'll kind of just like mask the vulnerable steps forward and just enter someone's space because they have that need. And it can it can build up to um a really big problems for a lot of people. So one on like the preventative aspects of sexual harm, and understanding that every human has needs, and help make those needs help those needs come to fruition. and also provide a space for people who have already experienced sexual harm to know that that's not all intimacy, it's not all sexual expression. It can feel like that, and there's a lot of patterns that can come up from that, and that really keep people at an arm's length, and real like intimacy and trust and like being able to work as a team in partnership can be very inaccessible, um, and and that can be very lonely and isolating. And for some people, that's what they want. Like I love my life on my own. Like it's a whole, there's many expressions of how one can do life. But for those that really want to be close and want to feel affection and want to feel mutual care and don't have access to it, um, I'm there are so many ways and that get in the way of us being able to have that, as it was in my own life. And I really think I just pull from the inspiration of how I was cared for and how I was helped and supported along the way. And it's a thing that I, at this point, just have so much experience, like 15 years at this point in this field, and want to do it a little deeper and a little longer. And, most surrogate relationships are a few months to many months long, and, weekly, or just more regular. And so having a more consistent way of being able to show up and support, for someone's well-being, that's feels a lot more gratifying, for me personally, and also like the work I've been doing for so long in the way that I want to set up and support people. Like, oh, there's another avenue to do it, in a different way, and so that's exciting.
Mm-hmm. Thank you for sharing your journey with us, Travis,
Yeah.
and your experiences. It's
Yeah.
your compassion and your heart truly permeate through this computer, through your words. You can really tell how deeply connected you are and passionate you are with this work, and your experiences have really shaped that journey, and continue, as you mentioned earlier,
Yeah.
that it's continuing to evolve, and it's an ongoing process of life and doing life in many different ways. So if someone wanted to connect with you, how could they do that?
Yeah, I'm always open to emails from anyone and everyone. Uh, so just emailing me is the easiest way to be in direct contact. Travis.sigley@gmail.com. It's just my name. And yeah, and please be patient. Communication is not always the easiest, but it is available. Yeah, from people I haven't met yet, but I'm very excited to make contact. Yeah, so I welcome it.
Great. Wonderful, Travis. Well, thank you again for being on the show. And to all of our listeners and viewers out there, as always, in loving wellness for your pelvis, this is Dr. Susie G. Until next time. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.